Hello, viewers. Welcome back to one more session with America Doctor channel. Today, we are going to talk about another interesting topic, fatty liver. As you know, lately that with the westernization back home, with the changes in the food habits, there are increasing number of cases of fatty liver. There are a lot of patients who are suffering from fatty liver. So fatty liver doesn't sound that dangerous, but unfortunately, it can lead to dangerous complications. Yeah, it can lead to dangerous complications. So, the reason why I say it can lead to dangerous complications and why it is dangerous is because when someone has fatty livers, it's a silent disease. You don't really typically have any symptoms. And when someone has fatty liver, there are various stages that liver can go through. Some unfortunate patients might go through this various phases. It could The one phase could be that it could just be that fat is deposited in your liver, and it doesn't really harm the liver, and people can stay in that stage for many years. You don't really have any symptoms, right? The next stage is when the fat starts to act up. Fat can be toxic to liver, and can cause problems. And once it starts to create problems, there is a lot of inflammation in the liver and can cause what we call hepatitis, and we label it as non-alcoholic steatohepatitis. Steato is nothing but fat. Steato is nothing but fat hepatitis, and it's not related to alcohol. So if you have to label someone with a liver disease with the kind of changes that we see, uh, they should not be drinking alcohol, or a very minimal alcohol use. So if you're slowly having a disease related to the fat deposition, it's called non-alcoholic, not related to alcohol, fat hepatitis. So now, once you come to this stage, it's similar to alcohol. When in alcoholic people, what happens is alcohol is causing toxicity to the liver, and here the fat is causing the toxicity to liver. You know, so the first one is called alcoholic hepatitis. This is called steatohepatitis. And once you are in this stage, the progression to the next stage sometimes might be inevitable, and sometimes you might be lucky that you might stay in this stage for many more years. So once it turns into a final stage called cirrhosis of liver, where what happens is without all the inflammation that happened over the years, the liver will kind of have inflammation. It will heal, form scar tissue. Then again, the inflammation, heal, scar tissue. And liver will shrink or become thick like a rubber, and blood can't pass through that liver. The liver has a lot of functions to do, but unfortunately, you have a thing that is like full of scar tissue without any active functioning liver, and that's when blood can't pass through and liver can't function well, and that's when we call it cirrhosis of liver. You know, that's when you start to see all the symptoms, the bad symptoms. First and foremost is you will see swelling in the belly, fluid accumulating in your belly, blood vessels kind of engorge, all your blood vessels on your belly and stuff. You might be noticing jaundice, your skin color is changing to yellow, you know, and your palms might become red, and you can have that engorged blood vessels in your foot pipe. And I don't know if a lot of people know that, but there is a lot of things about this alcoholics. People say that, this guy drank to his death and coughed up blood. That's what happens. Like when there are like engorged blood veins in the foot pipe, when they rupture, people bleed to death. I mean, unfortunately, there are many treatments that are available right now, but anyhow. And liver is a detoxifying machine, and you don't have that. And all the stuff, the toxins that get accumulated can cause changes in your mental status and other things. So this is the bad stage. Cirrhosis of liver is a bad stage. You don't want to be in that stage, either with the alcohol or with the fat. Okay. The next thing is like who are at risk for this condition. especially non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, and cirrhosis. People, so it's just like the any other risk factors like related to the heart disease. If you're overweight, or if you're having a lot of abdominal obesity, like if you're having a lot of fat build up around your belly, and you're overweight or you're obese, that's one of the biggest risk factor. you know Number two, you have type 2 diabetes. If you are uncontrolled sugars, diabetes, that can cause this thing. Number three, if you have bad cholesterol, very high levels of bad cholesterol, they're like LDL cholesterol, low density lipoproteins, or triglycerides, which are really high. These things can cause fatty liver disease. The next thing is some unfortunate people, like women, if they have PCOS, they're at higher risk. Sometimes patients who have low thyroid levels or other hormone levels, that can cause fatty liver and buildup of fat in your livers. Okay. I hope you guys like this video, and if you like it, please like, share, and subscribe.
మీరు నా ఛానల్కి సబ్స్క్రైబ్ చేసుకోవాలనుకుంటే ఇక్కడ కనిపించే సబ్స్క్రైబ్ బటన్ మీద ప్రెస్ చేయాలి. చేసిన తర్వాత అక్కడ బెల్ ఐకాన్ కనపడుతుంది. బెల్ ఐకాన్ కనపడినప్పుడు అక్కడ ప్రెస్ చేస్తే నేను చేసే కొత్త వీడియోస్ అన్నీ మీరు చూడొచ్చు.